this is thermal feature, which has the mission to enable its customer to make the world healthier, cleaner, and safer. And at the same time, behind a lot of laboratory achievements is the strong support from the company. So, ladies and gentlemen, this coming topic, we will be discussing a lot about solutions for pharmacogenomics research, and it's our greatest honor and pleasure to have Mr. Kevin Lin with us here. Hello, Mr. Kevin Lin.
For this presentation, I would like to introduce the solutions for pharmacogenomics research. My name is Kevin from Thermo Fisher Scientific, Micro Report Manager for Southeast Asia. Several reports are showing that total spending on medications is about 1 trillion in 2019, and the amount will be increasing to 1.1 trillion by 2024. However, millions of people are taking medicines that will not help them on a daily basis. If looking into major drugs in several important diseases, many of the drugs fall in the range of 25 to 57% of response rate, as shown on the right-hand side. Another increasing issue for public health is adverse drug reaction, especially for aging societies. Almost 3 million people experience ADR, which is the fourth leading cause of death in the US. The figure on the right-hand side is a patient with same diagnosis and the same prescription. Some may benefit from the drug, saying that the drug saved their life and kept them alive. On the contrary, the same drugs are non-beneficial or even harmful to certain groups of people due to adverse drug reactions. Pharmacogenomics testing can play an important role in identifying responders and non-responders to medications, which would avoid adverse drug reactions and optimize drug dose. Pharmacogenomic studies require genetic testing of individuals for multiple variants. Therefore, Thermo Fisher developed Action Pharmacofocus Array, which is ideal for several areas like pharmacogenomics research, academic hospitals, and healthcare centers, as well as pharmaceutical companies to conduct clinical trials. The first key benefit is the coverage of high evidence on pharmacogenomics content for a broad range of therapeutic research areas. Second, we combine genotyping data, copy number variation, and HLA analysis in a single assay with a 3-day workflow to reduce processing costs if several tests need to be done. Third, we only focus on high evidence of pharmacogenomics markers and provide fully configurable content to support your pharmacogenomics implementation goals. Internal data and external verification demonstrate the array data has high concordance to 1,000 genome phase 3 genotypes. Because of all of these reasons, Pharmacofocus Array is a configurable low-cost solution for preemptive pharmacogenomics research. We recruit the markers with high evidence in Pharm GKB and the CPIC with total number of 2,000 markers to cover 150 genes. The coverage of actionable content is over 85% of variants in CPIC guidelines. Per Pharm GKB notation, the number of markers in level 1 and level 2 is 250. Among these markers, adverse drug reaction is the most important component, with 36% of the variants linked to ADR and 10% linked to dosage, 31% linked to efficacy, and 14% linked to metabolism. The key feature of Pharmacofocus Array is a single assay which is able to provide 3 types of data: genotyping, copy number, and HLA typing. Several markers are selected in region of high homology. take CYP2D6 as example. This gene has dual gene on CYP2D7 and CYP2D8. To genotype these genes would be quite challenging for many technologies, like exome sequence or short-read sequencing. To overcome the challenges, we use multiplex PCR to amplify the homologous region and detect the signal by microarray to get accurate genotype results. In the middle column, the table lists 10 copy number regions which can be detected by pharmacofocus array. Copy number regions are designed to detect high-value genes which have impact on enzyme activities and affect the efficacy and the toxicity of drugs. Copy number calling offered in CYP2A6, CYP2D6, and another 4 genes, as shown in the table. The third data is HLA typing to cover 11 loci of HLA which have influence in individuals' response. We also offer HLA analysis software to generate HLA typing data. The data have been verified with 480 samples, consisting of 326 cell lines, 72 barcode swab, and 72 saliva samples. The verification results can be found in the table. Concordance rate between 1000 genome phase 3 is 99.91%. An external verification is conducted by RPRD Diagnostics, which is a CLIA certified lab to run early access of pharmacofocus array. RPRD has our Gene Titan instrument to validate pharmacofocus array data with the existing data. The concordance rate can be found in the website with 99.6% at probe level concordance, 99.3% at star allele concordance, and 100% in copy number for CYP2D6. Pharmacofocus array has more than just genotype data, as we mentioned earlier. The software will translate the genotype data into phenotype data. Because star allele have been defined by a set of genetic variants, and the function of the alleles have been defined as well. So the software can base on the genotype data for the downstream analysis. The analysis includes pair of allele data and the related allele function, as well as enzyme phenotypes, such as normal, rapid, or poor metabolizer. The genotype data and the phenotype data are compiled in the comprehensive report and the phenotype report from the software. This phenotype report with star allele data is useful for translational research. For example, University of Pittsburgh Medical Center, they take the phenotype report and then link the report to their own medication management systems. For the service provider in US, they would prefer a comprehensive report along with drug guideline and genetic variants. Korea Life Sciences is Thermo Fisher preferred partner for pharmacogenomics reporting. Here is the example showing that gene and drug response report from Korea Life Sciences. The report will summarize the genetic variants and the relevant guidance, including drug name, recommendations, and the related therapeutic classes, like ADR, efficacy, and dosage. To facilitate pharmacogenomics data analysis, our software has integrated star allele reporting on over 970 unique haplotypes across 66 genes. The table shows subsets of star allele, which are reportable on pharmacofocus array. We offer flexible configuration of panels. First panel is a premium panel, which is a comprehensive coverage on 150 genes with 2,000 markers. We keep communicating with the clinical labs on the demand of pharmacogenomics testing. The amount of the genes they request is sometimes less than 50 genes. For those who have other needs to down-select the markers, the researchers can base on the premium panel and select the genes of interest to be designed on the array. The corresponding panels are advanced panel with up to 50 genes and 1,000 markers, or light panel, up to 15 genes and 200 markers. The key point is that 3 panels are using the same array, just a different way to output the data of interest. Here is a summary of pharmacofocus array. The markers are selected to have comprehensive coverage for preemptive pharmacogenomics. The coverage of actionable content is over 85% of variants in CPIC guidelines. One assay can provide genotyping, copy number, and HLA typing. We provide premium panel with 2,000 markers for the researchers to customize into advanced panel or light panel with lower costs. For the next few slides, I would like to draw your attention to the application of using microarray for biobank and the National Precision Medicine projects. In the last 10 years, many biobanks and the national initiatives are focusing on reducing healthcare costs and finding genetic variants of diseases. As you can see from the chart, many biobanks projects cooperate with Thermo Fisher to design population array and bank the genotype data for the studies. The projects shown in the previous slide were using Axiom customized SNP array to design population-specific content for the studies of predictive genomics. Thermo Fisher has the expertise on the imputation SNP design and can cooperate with the researchers to design population-specific array. The amount of the markers can be designed on the array is around 700,000 to 800,000 markers. We keep updating the modules in our database. When customizing the array, we can share the content with the customer to choose which modules should put more markers. As you can see from the chart, if they are interested in some of the modules, we can provide a very flexible design to select each individual markers. UK Biobank cooperates with Thermo Fisher to customize UK Biobank array with around 800,000 markers. From the chart, you can find a summary of the markers designed in the array. Currently, they have shared the genotype data from 500,000 samples for researchers to identify novel drug targets and pharmacogenes. UK Biobank has published the array design results and do a comparison. The figure demonstrates the imputation performance in UK Biobank array as well as several commercial arrays. The blue line is the performance of UK Biobank array. This array shows very similar performance to one of the commercial SNP array, which design around 2.3 million SNPs. The number of markers is 3 times compared to UK Biobank array. UK Biobank array seems to have better performance compared to another commercial SNP array, which is not designed to specific population. The overall conclusion of this analysis is that UK Biobank array is a very good design to have high coverage in UK population and several clinical research markers. We will encourage the Biobank project to customize population-specific array instead of compromising to use commercial SNP array. Finnish Biobank cooperates with universities, hospitals, and international pharmaceutical companies to design the array. One of the applications is the pharmacogenomics study, which includes 4,600 pharmacogenomics markers in the array design. The aim of Finnish Biobank is to match genomic information with healthcare data. This study is expected to continue for 6 years. Like in the UK Biobank collaboration, pharmaceutical companies are involved in the Finnish Biobank study. Taiwan Precision Medicine Initiative also cooperates with Thermo Fisher to design population-specific array. The GWAS markers are designed based on 1,000 Taiwanese whole genome sequence data, We also share functional snippets from our database to design the array. Totally, 700,000 markers are designed in the array. Among these markers, 400,000 markers designed for GWAS, another 300,000 markers designed for the association with disease, rare disorders, and pharmacogenomics. Taiwan Precision Medicine Initiative is a partnership with top medical centers in Taiwan to bring genetic information into clinical practice. Starting from October of 2018, this project has enrolled 0.3 million samples and genotype 0.2 million samples. This project aims to enable early cancer screening for high-risk participants and build up a pharmacogenomics database, either for medication efficacy and lifestyle recommendations. The project is preparing for making genetics information part of future clinical care in Taiwan. In the end, we are looking for the collaboration in Southeast Asia for the implementation of pharmacogenomics into routine tests. If you are interested in pharmaco-focused array and would like to set up the in-house tests, please scan the QR code here on the right-hand side and fill in the form. Then our representative will contact you as soon as we can for potential collaboration. Thank you for your attention. I'll be glad to answer any question for today's presentation, or you can send me the email after the meeting. Thank you.
Thank you very much, Mr. Kevin Lin. We have learned a lot from your presentation. And because thermal feature is always in the spotlight, that is the reason why we have got some questions from the audience out there for you to answer. So would you please?
Can you hear me? Yeah. Hi, thank you. Thank you for the question. Hello. Yeah. So thank you for the questions. Yeah, so actually there are two questions for this presentation. The first one is the how is the solution for the clinical implementation? Thank you for the question. Hello. Yeah. Okay, thank you for the question. So thank you for your attention on my presentation. My name is Kevin. Yeah, so actually there are two questions for my presentation. The first one is the how about the solutions for the clinical implementation? And although this microarray data would be used for the research use only, yeah, but from my experience that we can work with the clinical lab to validate the results and try to get the certification like the CLIA lab or CLIA certification or some kind of CAP certification. So take one of the example, the University of Pittsburgh Genomics Center. They adopt our microarray solution, although it's research use product, but they validate the results. Then they use the clinical the result for the clinical report. So in the first beginning, they would use our array for like the research. Then they validate the result for the certification of the like CAP certificate lab. So in the end, they implement the array data for the clinical report. And the other one is like Taiwan Precision Medicine Research. They would like to collect hundreds of thousands of the sample data. Then they have some validation. Then in the future, they would incorporate the microarray data into the clinical report. Yeah, so the answer is that our solution is research use. Yeah, but we can work with the customer. Yeah. Yeah, so we work with the clinical lab to validate the result. And in the end, we can work with you to have the clinical report in the end. And the second question is the cost per sample regarding the HLA typing. Now, actually, our microarray solution, just during my presentation, we incorporate three types of data: genotyping data, copy number data, and the HLA typing data in one solution. So actually, from this solution, you can easily get three types of data. So regarding the cost on HLA, actually we don't separate the data. So in overall solution, we have a complete data for this kind of application. So if you are interested in the this kind of application like focus array, we can offer the genotyping and the HLA as well as copy number. You can scan the barcode during my presentation, or you can just email me. Then we can discuss more on the detail how to work with you to have a very affordable price